Great. Thank you so much for that, Dr. Fuhrman. That was a really great presentation. So we're going to begin the Q&A portion for the audience. If you'd like to ask Dr. Fuhrman a question, you can do so by raising your hand in Zoom. The instructions will be placed in the chat. Many of our speakers have started talking about health beyond what traditionally were the things that we focused on in terms of diet and exercise. And they're talking about things like community, relationships, and the such. What, in your experience, I mean, obviously your talk was heavy on this today. What is driving that all of a sudden we're realizing the impact of these things outside of diet and exercise on our health?
Well, I think that's an important thing to mention is because, some of us, myself, for example, used to be paid from Whole Foods Market and other corporations to reduce their healthcare costs by educating their employees into healthy eating. And we'd see only a small percent of the people that are exposed to this information that would actually apply it in their lives. And so there's a large number of people who have learned about healthy eating that don't do it or have recidivism and deal with food in an addictive manner. So I think that in looking at our own personal inadequacies, our own personal failure in able to reach people, to motivate them to make the changes we want them to make, has enabled us to try to go into to able to study the underlying emotional reasons why people don't live healthfully and choose not to live healthfully. So I think it's critically important for us professionals who are invested in trying to get people to live a healthy life and reverse their diabetes and reverse their heart disease and reverse their obesity and reverse their autoimmune disease. They have to be able to comply with the recommendations. A lot of us are giving recommendations that we could be somewhat a little bit minor points of deviance from each other, but it's all worthless if nobody's following it anyway. We're talking about that people are living on fast food and junk food and keep overeating all the kinds of garbage, and they won't stop no matter what you tell them to do. And they can't stop, even though they've learned this information, and they feel guilty about not being able to stop. So I think that the need to go into more than just the science of nutrition and food, to be able to enable people to understand what are the social implications and the emotional implications of their behavior. And as we know, being happy in life and living a long life is not all food. So us lifestyle medicine specialists have to expand our knowledge base to learn about exercise, right? And emotional poise and pollution. And so we have to expand our life, because just food alone is not going to do it. You have to have while you're under chronic stress your whole life, you know what I mean? So we have to say, well, what are the factors that lead to chronic stress? And how does that chronic stress create people's inability to live healthfully? So it's all interrelated, I think. So we got to teach and learn this in a integrated form.
So what I'm hearing is that in the past, people will be speaking about all this great information about how to be healthy, and yet people were learning this information and not acting on it. And instead of saying, it's your fault for not listening to us, people are now stepping back and saying, how should we be communicating and crafting our message in order to get people to be able to actually act on this information?
That's exactly true.
All right, great. And so you talked about communication, and you see this all the time with people communicating with other people, and it's not really what they're talking about that they're arguing about, it's the way that they're communicating. And you gave an example of someone that was I forget the exact example, but you gave an example of poor communication. Can you give us an example of how someone should respond when someone comes at you negatively? Like, you're talking about health, for example, and they come at you and they attack you. What would be a good way to respond in a way that's not ego-driven, that neutralizes that the propensity for escalation, that distracts us from being an effective communicator?
It's relating to something that relates to them. Is that like something that's funny? I used to think the same way too. I used to think that way too, and luckily I changed the way but of course I learned something that helped me personally. It may not help you, but you know what? Now there's something I can relate to you. I like that. You're such a nice, I like that you did this thing. You think of something good you like about them. I love that I thought that I love that you were so considerate. I love that you have this. I so much that you're such a bright, something that you appreciate about that person. And, you know, if I could have some ability to have a positive effect on you, this is what I think you should maybe consider or look into this. So in other words, it's not taking it personal. It's trying to relate to that person, in some way show them you care about them, and then explain why you live this way, but not with the intent to convert them to what you live. Because you don't want to push them to try to push them back. We're not trying to change their behavior. We're trying to have them respect why you made the change for yourself. It'll come to a time where they may say themselves they want to make that change. But we're trying to build a relationship with them, build their feeling that we care for them, and earn their understanding for what we do, why we're doing something possibly. All while we're thinking, is this goodwill for this person? And then when we built this relationship, see, if you're taking somebody, even somebody you love, if you're trying to force them or batter them into change, they're going to push back in the other direction. But if you show them, you know, if you show them that you have consistent, and you can say, you know, consistent care for them, consistent love for them, that's not based on their own behavior, that's like unquestionable. And then they'll be more likely to consider what you have to say. And you don't have to have the intent to make them change right now. You just have to have the intent to make them consider what you're saying and them understand that you're speaking from your heart in their best interest, right? So there's a lot of ways we can use our creativity to have goodwill for them. And that could be being humorous, or being shown that we relate to them and feel for what they're going through. But we don't have to be protecting of our own egos or feel threatened by what people say to us.
Great, thank you. And I love what you had to say about dopamine sensitivity, and specifically dopamine insensitivity. So then you were talking about how food and this hyperpalatable food was making us less sensitive to dopamine. And then driving us to seek foods that fed our drive for dopamine. Does the way that we eat and the fact that it fosters a dopamine insensitivity, does that, based on your experience, also drive the behavior for people to sit there and scroll on their phones? Like, does the food we eat and its impact on dopamine drive other behaviors outside of food-related behaviors to seek for dopamine?
I'm not so sure about that. But we use the term dopamine and dopamine sensitivity, but certainly it's an oversimplification of the neurologic messengers and how the brain actually works. It's helpful for people to understand it, but it's more complicated than just one neurotransmitter involved. It's, there's cell communications, and we're saying here is an interaction between the digestive tract, the byproducts produced by bacteria in the digestive tract, the blood-brain barrier, the neuropeptides, the dopamine, it's all, leptin, GLP-1, but even those are oversimplification because there might be 100 different hormones and messengers involved here. So yeah, to a degree it makes sense that, but we know that feeding children sugar and using parties and holidays and rewarding them with donuts, it does lead to them moving to other addictive substances and addictive behaviors. That's true. So we do look for other ways we get addicted to being overly stimulated. But that predominantly comes with overly stimulated with food, and of course moves on into high school to drugs and to alcohol, and then could move on to more serious drug abuse in later life. But fast food and processed food and sweets and fried foods are highly addictive substances and are very difficult for people to want to give up.
Thank you. So many years ago, I was talking to somebody about not feeling great, and they said, well, look what you're eating. And it was like, an aha moment for me to correlate how I was feeling with what I was eating. Why don't people tend to associate their health and specifically how they feel at any given moment based on what they just put into their body?
Because it's called cognitive dissonance. When my daughter was 4 years old, she said, why are these parents poisoning their children? I said, don't these parents love their children? Why are they feeding the children junk food? I said, well, they don't know what's bad for them. It's like if everybody smoked cigarettes and all the kids were smoking on the playground, you wouldn't think it's bad because everybody's doing it. But so it's one hand, it's the addict or the person abusing their body blocks from their conscious cerebral thought the idea that they're harming themselves. So it's blocked away, and the addictive brain accomplishes that. The accomplishment of the primitive brain is to lose the cerebral function of the cerebral brain, and so it doesn't have power over your behaviors. So the primitive brain can gain power over your behavior, and that's the nature of addiction. So addiction now takes over your conscious thinking, and the brain now, your cerebral brain, tries to rationalize why it's okay to continue being addicted or continuing to consume self-destructive substances. So now the person's lost their ability, they've lost the keys to the bank. Their own thinking and behavior is no longer intent on their own self-interest. There's too many other motives mixed in there that are biologically focused on chemicals in the brain or affecting your thinking. And now I'm saying this person is more prone to being subjugated to bizarre conspiracy theories and can be politically indoctrinated to be more violent or angered or be more callous and selfish and be more of other people and more into their own narcissistic. So the diet fuels into this negativity bias of the brain and the narcissistic tendency of humans who now the primitive brain is more powerful than the cerebral brain, and we gotta switch the power there to get rid of addiction, and also it benefits the person's ability to be happy and to be content and to live a longer life. So and we could see it happening, and I discussed that the word pellagra is a disease from niacin deficiency that leads to confusion, aggression, and even homicidal and suicidal behavior. And there was a huge explosion in violence and crimes in the mid-1800s and late 1800s from pellagra in the South, and it causes people to get they call it a causal necklace, a red neck, due to from people eating too much corn, molasses, and pork, and not having enough vegetables and beans in their diet. And it wasn't until the early 1900s when a doctor first discovered that pellagra was due to niacin deficiency that could be cured by eating vegetables, and they were able to release these angered, violent people from prison and reduce their recidivism as they ate healthier. And we're seeing this today. There's so many people today who have these nutritionally deficient brains that are more angered and violent and bizarre thinking and led in the wrong direction and more narcissistic and selfish behaviors. So we see that. So the human brain is very complicated, and our behavior is affected by what we eat, right? By the healthy diet leads to a healthier brain that can be more logical and more peaceful and less irritable and less easily angered and more compassionate.
Thank you. So if I'm hearing you correctly, some of the cultural issues and the social issues that we're dealing with today can be attributed to our health status, particularly the types of foods that we eat and the way that we take care of ourselves.
Absolutely. And we see that in that areas where they eat the worst have the most brain injury, lower economic achievement, lower job performance, lower happiness quotient, more depression, more crime. We see that the measurements of brain health and societal health is impeded by exposure to unhealthy food and lack of food in the environment people are raised, lack of healthy food in their environment they're raised in.
So you had touched on the microbiome during your presentation. How has our understanding of the microbiome over the last decade or so changed the way that we understand health in general?
You know, it's interesting to be able to see how the body works in conjunction with each other. But, you know, the recommendations were the same. It's just that we have more reasons for the recommendations. You know what I mean? So it's still, in other words, taking probiotics might be helpful, and taking broccoli sprout extract and resistant starch powders and, you know, and modified citrus pectin, these things might be helpful.